Tonight, we are learning more about a drug-resistant strain of bacteria recently found in eye drops. As of March 21st, the CDC reports 3 deaths linked to this strain. More than 65 patients were infected in 16 states, including North Carolina. WXI 12's Kara Peters spoke with a local doctor on this bacteria and how you can best stay safe.
Pseudomonas aeruginosa, a bacteria that doctors say is not new. However, now health leaders, along with the CDC and FDA, are digging deeper on an outbreak strain present in a common product, artificial tears.
Pseudomonas is one of our most common enemies when it comes to eye infections, especially in contact lens wearers. The problem with this variety that we've heard about with the eye drops is that it's kind of been resistant to antibiotics, so that makes it tougher to treat.
But it's not just something contact wearers should watch out for.
Sometimes well water can have bacterial pathogens that we worry about, or lake water. So if you've been in that environment and then maybe rubbed your eye or maybe used these artificial tears that are not standard, then you're have a riskier behavior than most.
The CDC reports 3 people have died from this strain, along with several cases of vision loss and surgical removal of the eyes. At this time, both the CDC and FDA have advised people to avoid using artificial tears by EzraCare or Delsum Pharma. And Dr. Walter advises those that utilize artificial tears to avoid the non-branded, but instead look for more recommended products.
The most common are probably Sustain and Refresh tears, and then also Retain is a good one. TheraTears is another good one.
Dr. Walter recommends anyone wearing contacts to clean and change them as directed, and also to recognize the signs of a possible eye infection like blurry vision, redness, or any discomfort.
Get fresh eye drops. Make sure you're not going to be a victim of this potentially blinding bacterial infection.
In Winston-Salem, Kara Peters, WXII 12 News.